We're recording. Okay. Awesome. Hi, everybody. I'm Dr. Kirsten Lauritsen. Today, I am bringing you an interview with one of my colleagues from school, Dr. Kaitlyn Haese. She is a chiropractor out of Eugene, and she has a lot to share with us today about pregnancy, about postpartum, and also tying in maybe a little bit about sports medicine and how all of that connects. So welcome, Kaitlyn. I wanted to start out and ask you to just introduce yourself, let us know kind of how you got to where you are today, and we'll start there.
Perfect. Well, thanks so much for having me on here. I really appreciate it. And it's great to see you again.
I know.
As much as we can do in person, the videos are a lovely way to do it at this point in time.
Mm-hmm. Yeah. How are you doing with this whole COVID thing? Has a lot of things shifted for you, or things kind of the same? What does life look like right now?
Yeah. So we've kind of shifted. We have shifted away from patient care in person for a while. I did some appointments via telehealth, and actually just this week we started seeing patients in person at a much slower rate so that we can really evaluate how things are going and making sure that everybody is staying safe and we're taking all precautions necessary, and then allowing for us to kind of adjust as things change.
Yeah, absolutely. I had to change a lot. I already had like some of the functional medicine stuff online anyway, but it changed a lot once I moved everybody online. And then a portion of my practice also is chiropractic, and so all of that changed as well. I mean, I didn't see anybody for the most part. I mean, I saw a few emergency cases, but for the most part, I really didn't see anybody over, the whole month of April, and it was very, very strange.
Yes.
Yeah.
It feels really good to be back.
Yeah, I know for sure. So tell me a little bit more about what you do, how you help with pregnancy, and we'll just start there, and then we can move into a few tips about with postpartum and all of that.
Yeah, absolutely. So as a chiropractor, definitely looking at structural alignment as well as then how the body is functioning in its movement patterns. I see some women who are finding me because they're in quite a bit of pain, and somebody recommend it, whether it be their OB, their midwife, a friend, family member. And so sometimes they kind of trickle into my office because of that. And then there are other people who have just heard that it can be good in helping assist just with carrying baby while pregnant, as well as making for a potentially easier labor and delivery. And so then they're interested, right? Because everybody wants to know more about that. And that's not necessarily my goal. My goal is really to how can I help them stay active, stay strong in their pregnancy so that they are ready for that kind of endurance challenge, right?
Yeah. Is there a lot? So for somebody who maybe is thinking about becoming pregnant in the next maybe year or so, what are some of the things that maybe they could do to start working on just strengthening some of those areas before going and becoming pregnant, and why would that be really helpful?
Yeah, so I mean, if you think about all of the changes that have to go through your body, like that your body has to go through in order to carry a baby and adjust to that change in center of gravity, right? The all of the movements of the pelvis are changing to allow for the space for baby and your uterus, as well as then kind of prepping for that movement that's needed for delivery. And so if you are planning on becoming pregnant in the next few years, I think it's a really great time to dial in nutrition and just overall health, right? Just being a little bit extra conscious about what your choices are and really why you are making those choices, right? A lot of times we just go through the day just doing what we need to do to get through the day, and just adding a tiny bit more intention can really help to create some of those shifts and those patterns. And really what that does is it just sets you up so that, many people experience some nausea, discomfort, a lot of fatigue that first trimester, and then they feel really, they kind of get hard on themselves and feel discouraged because they're like, I know I'm supposed to be eating well, I'm trying to nourish this baby, but I feel terrible. So by having those stores built up prior to conception, you're just putting your body in a better place. Now, that doesn't mean that if you didn't plan ahead and you're finding yourself with a bit more of a surprise, like you have time to kind of restore some of those, but you're just going to feel better if you have some nutritional stores built up.
Yeah, absolutely. Actually, I want to dive into that. I have a couple questions based on what you just said, but one of them I know for sure that I work with is that, and as you said, there's sometimes that you just end up with a little bit of a surprise and not a whole lot of time to prepare. But and I think one of the things that's shifting a lot right now is that a lot of people who are our age are having children later and later, and they're starting to do a lot more planning than really just surprise. And because they're starting families later, and because they're somewhat having some time to plan for it, there are some different things that we really can be doing. And one of the things I talk about a lot is just nutrition for sure, is making sure that, as you mentioned, building up those stores and eating a really just kind of decently solid nutrition palette, just so that you have a wide variety of nutrients going through your system. But also, also try to focus with people on removing some of their toxic load, because some of the things that we've seen over time in research is that babies are being exposed to a lot more toxins than we actually think, which means that when they're, coming out into new life, they've already been exposed to a lot of things, but they don't usually have that immune system built up, because that's a process that happens after birth. And so we are seeing this very interesting shift that I am now seeing in the adults from that time period, right? They were exposed to a bunch of different things when they were, infants and kiddos. And it's that setup that then leads to them, when they're 20, 30, 40 years old, that's when I come in, because they've got things going on. So I love the idea of being able to plan. And I love the idea of being able to at least just try to set ourselves up for just a little bit more of a, successful, maybe is not the right word, but very, I think just a nice pregnancy. I think that's always a dream, right? We hear of some very, very awful pregnancies, and then we hear of some where people are like, oh, I'd be pregnant forever. I would love that. So I like the idea of being able to plan and kind of see if we can build up some strength, build up some nutrition, some nutrition stores, and really see how that can help us get through pregnancy. In those first 3 months, it's about the first 3 months or so of pregnancy, it can be really, really uncomfortable. Do you see patients a lot with, morning sickness, things like that? Are there some tips that you might have for people who are kind of having a really difficult time during that period of pregnancy?
So I have some tips. It's nothing like magical that you probably haven't already heard before. Like ginger can be super helpful with nausea, whether that be, more of like a straight up ginger tea or a tincture, or, just having kind of adding it to some of your recipes that can help to relieve some of that nausea. I've had a number of patients and a number of friends who are just trying to do as much as they can, right?
Sure.
So eating in really small doses, trying to choose like very nutrient dense foods, so that even if they're not consuming a large volume of things because they can't handle having that full of a stomach, that they're still getting as many nutrients as possible.
Absolutely.
I know sometimes women have a hard time with the prenatal vitamins, especially that first trimester, continuing to take those if they can't keep them down. And I've had some women, kind of opt for the gummies. Is that the best? I don't feel like I'm qualified to say, but
Sure.
I am definitely like totally on board. Like, do what you can, right?
Yeah,
Do what you can in
absolutely.
those first 3 months or so. And, drink lots of water, try to, take each day as it comes, and then you get to build up kind of what you maybe have lost and what baby has taken out of your stores during those next several months and into postpartum. And I think that's like the biggest thing, is that baby's going to take what they need. And that just
Absolutely.
means that you just kind of end up with less in your stores. And so being able to replenish that postpartum is so important. And I think that's kind of like one of the biggest things is just kind of planning for postpartum as well.
I think we forget, right, a little bit about the postpartum phase, and then that's when it kind of catches up, right? You've had this 9-month long just excitement almost of leading up to this new person being, with us in our life. And then I think a lot of the work comes in the postpartum phase. And that's when I think a lot of so it's definitely, I see some patients who are in pain during pregnancy, but it's the afterwards that there are some things that we can definitely work on. You got your master's in sports medicine, and you mentioned that that is tying in a lot with how you work with different movement patterns and helping your pregnant mamas and also postpartum as well. How do those movement patterns change? And then also, can you kind of go into a little bit more about how all those changes can leave us in pain afterwards, and what do you commonly see?
Oh man,
questions.
there's a lot. So I think, again, most people come to me with more acute pain in pregnancy, whether that be pubic symphysis pain, SI joint pain. Sometimes it's low back pain, right? Hip pain. Those are like really common. And while we can definitely treat those, we can not only structurally through chiropractic adjustments and manual therapy and working with the muscles and the ligaments, but also maintaining that stabilization or creating it. I see a lot of women who have been going through their daily life and they've been able to get through just fine, right? But then you add that extra load, both physically and structurally, and it gets to be kind of too much, right? Yeah. Or they will be fine in their first pregnancy, and then it's in their second pregnancy that all of a sudden they're like, oh man, some of these symptoms that I was feeling my last month of pregnancy, I'm starting to feel, and I'm only 3 months in. Now what? Because a lot of women, if they're feeling it only towards the end of their pregnancy, they just choose to stick it out and hope that it will go away after birth. And sometimes it does. Sometimes it doesn't. And then sometimes it will just it maybe felt like it went away, but it's kind of flares back up much sooner in the pregnancy, in future ones. Yes. And so we can work on that structurally, but again, that support during pregnancy is so key because it really changes just how you carry your baby if your core is able to support you versus just creating all of that strain on your low back. And then moving into postpartum, that's often where most women feel the weakest is through their core, and they then often develop different compensation patterns that can persist if they're not addressed. And sometimes even just how we move in pregnancy can either increase or decrease the load on any specific structure. Really, our goal is to create a balance between the whole core system, basically from here all the way into your hips, and sometimes your lower extremity can be involved. And depending on how the rest of your spine looks, sometimes we even end up working into the cervical spine, because if we're here like this, well, then all of that strain is on the neck as well, right?
Yeah, absolutely. I also in all of that was thinking as well about when you are breastfeeding, and that whole piece is that I usually see a lot of patients because they have upper back pain now that used to be lower back pain, but now they have upper back pain because they're breastfeeding, or all of the process of picking up the kid and, and moving them around and carrying them. It's quite a lot of load on the musculoskeletal system, and there's so many different patterns and changes that you end up making. And of course too, I think we also will see a lot of moms carrying baby on one side, and then when they have two, now they're evened out and they have them on both sides. But when they only have one, I've noticed that I start to see these patterns where I start to wonder, do you carry your kiddo on your right side, and only your right side for the most part? Because you can see those changes. And I always think that's just so interesting when you start to really look at the musculoskeletal system. And you and I, you see patterns, and all it takes is just understanding where and why they're getting those patterns, and then we know more or less how to fix them.
Right. Well, and I have found it really interesting that, you take 9 months to grow a baby and your body gets to slowly adjust to, carrying this baby in your abdomen and through your pelvis, right? And then in one day, now all of a sudden you're carrying them in your arms, almost 24/7, right?
Right. Right.
And that's just really hard on your body. And then you just think about your core ideally is supporting your torso. And after having a baby, your core is pretty stretched and kind of taxed after several months of carrying this, quite large baby. And now all of a sudden your core doesn't feel like it's quite strong. And now we're like carrying baby like this. So I try to really spend a lot of our time in pregnancy, also kind of starting the conversation about what things look like postpartum, because the more that you can do to plan for your support systems, and how you might move your body, what is okay, what might you want to avoid for a little bit longer than you would sometimes think, just so that they are educated and during a time when they're excited versus when they're completely exhausted, right?
Sure. So
it's hard to take in some of that new information postpartum.
Yeah. Are there yes, absolutely. There's quite a difference for sure. Are there things that moms can be doing when they're pregnant to help strengthen their core for afterwards?
Absolutely. A lot of what I do uses functional movement patterns. A lot of the core is actually based in breath work and using that to stabilize your core as a system, a cylinder. So we talk a lot about the walls of the cylinder are your transverse abdominis, then your pelvic floor is the bottom of the cylinder, and your diaphragm is the top, right? And you want that whole system to be able to support your spine, your uterus, your baby, right? During pregnancy, but then that also sets you up for those muscles now aren't completely forgotten about, and then you're trying to figure out how to activate them postpartum, right? So just kind of doing this prep work. And honestly, in early postpartum, like those first 6 to 8 weeks, the main exercise is this breath work, because you really want to take the time to slowly progress your exercise and your movement habits postpartum so that you aren't creating unnecessary strain on your core and your pelvic floor.
Yeah, so that's actually not something that's like, I got to do a bunch of planks or a bunch of sit-ups, or I got to do a lot of weightlifting or anything like that. That's breath work is actually something that's fairly gentle and simple, and something they could definitely do at home, right?
Exactly. And one of my favorite things about it is like, you can do this while you are baby wearing postpartum, right? You can do this while you are sitting at your desk if you are, working from home these days, right? A lot of these things you can just incorporate into your daily life. It doesn't have to necessarily be this strict exercise regimen. And often, especially in pregnancy, some of those moves are actually not recommended, right? Because we don't want to be creating a ton of extra pressure through our abdomen. So sit-ups aren't the best thing. And that includes getting out of bed, right? Sometimes even just, getting in and out of bed, on and off the couch, and you're trying to do this heaving sit-up with a big belly, like that's just very challenging and really taxing on your hip flexors, because typically you're not using your core, you're using your hip flexors, which then put more strain on your low back.
Totally. So those hip flexors, let's kind of expand on that a little bit for people who aren't really sure what that means. Hip flexors are more like, well, you want to go ahead and expand on that, psoas type muscles.
Absolutely. So your hip flexors basically create your ability to hinge at the hips, or what sometimes people will call like the waist, right? And when you do a forward fold, that muscle that attaches to the front part of your low back, so your lumbar spine, and then it connects to your femurs, your leg bones, right? And so it basically allows you to kind of fold in half, so to speak. But when you're doing that sit up and we're not using our core in a very intentional way, that muscle is already ready to do the work because it's usually in a shortened position most of the day. We spend a lot of time sitting, especially those of us who sit at a desk. And so that muscle is always in a shortened position. And then therefore, when you go to ask your body to do a particular movement, it's going to say, oh, I can do this. I know, I'm always ready.
Right. Right. So what is a way that they could move a little bit differently than doing that, kind of heaving sit up?
Yeah, absolutely. So typically I recommend that patients roll to their side, like all the way completely. Once they're lying on their side, then using their hands to kind of push themselves up to a sitting position and let those legs kind of fall down to the side.
Oh yeah, like I teach people to do that when they have a really bad low back pain.
Exactly. Exactly. And
Yeah.
it's one of those things that most of the time it becomes a topic of conversation in pregnancy, and then but it continues, like that's still is a really great method of getting in and out of bed postpartum and even beyond that, because like you said, we also teach it to our patients with low back pain. And it's not something that once the pain goes away that then you should just stop doing that. It's just one of those things that, especially since we put so much load and work into those muscles, to give it one consistent time per day that you're not using it.
Sure, giving it a little bit of rest. That sounds
Just
nice,
a little.
doesn't it? Just a little. Okay, I really wanted to expand a little bit more on that, and then I want to kind of shift into some things that people can be doing at home, since this is sort of one of those times. But I wanted to talk a little bit more about postpartum and dig a little bit
Mhm.
deeper into really. So one of the things I see a lot in practice is patients who, when they jump or when they do a lot of sort of like jumping movements, it's something that is normal. So I would say it would be really kind of interesting to go into, what do people think is a normal thing that really is something that should not necessarily be there. But one of the things I see a lot is with a lot of jumping that people will, uh, have a little bit of urination in their, when they're jumping, right? And they'll
Mhm.
pee their pants for lack of a better term. And I always try to educate my patients, because that's actually something that isn't normal. That's something that you can absolutely fix. Do you see that pretty often?
Yes, absolutely. And sometimes like those symptoms of stress incontinence, so
Yep.
anytime like you're laughing, coughing, sneezing, or jumping, that's putting a lot of stress and strain on your pelvic floor. And many people, clinicians included, recommend Kegels. That's like this
Right.
automatic go-to thing that we've heard about for a long period of time. But as we have learned much more about the pelvic floor, not everybody needs that strength traction extreme lift, right? And our pelvic floor really needs to act as a trampoline. It needs to have some stability, right, to be able to hold all of your pelvic organs in your body, right? But it
Yep.
also has to be able to have some give and some relaxation, controlled relaxation, right? So jumping, you need to have some give so that when you jump and then you land, that your organs aren't just being hit by this brick wall of your pelvic floor, right?
Sorry about that.
And so we really want that kind of a springy type of a pelvic floor. So for some women, especially, I notice a trend in many of my athletes is that they actually need to focus more on the relaxation of the pelvic floor. And so I'm not trained in any internal work. We mostly work on it from a functional standpoint, and then I refer to pelvic floor PT when that's needed.
Got it. So what are some of the things, like maybe one or two things that people can do to get a little bit more of that flexibility? So talking about athletes or pregnant or postpartum or excuse me, pregnant women, what are some of the things that they could do? Just one or two.
Right. So sometimes women, like when I ask, they'll know and be like, "Oh yeah, I'm for sure a clencher,"
Hmm.
um, and other people don't necessarily know, right? So one thing that you can do is even just see what it feels like to access that area of your body, right? So when you breathe in, can you create that diaphragmatic breath all the way down and create some kind of pressure into your pelvic floor? And sometimes it might even just feel like it's widening sideways versus lowering. So you might feel like this little lower and then kind of this expansion sideways between your sit bones. So if you think about really just sitting on your two sit bones right underneath your glutes or your butt cheeks, and see if you can create this tiny sensation of widening of that space. And a lot of women are like, I don't even know what you're talking about, right?
Yeah.
And so if your body needs like a little bit more tactile awareness, or the ability to kind of have more sensations that your brain can connect and be like, oh yeah, that's what it is, you can roll up a yoga mat. My favorite are like the really flimsy, cheap ones, because they tend to be like a little bit better of a size. But you roll that up and then you actually sit on it so that one sit bone is on either side of it.
Okay.
Does that make sense?
Yeah.
And then you basically are creating a little bit of pressure through your pelvic floor, which having some pressure from the outside will allow you to kind of feel potentially that that widening, right, or that relaxation of your pelvic floor into it.
Absolutely. I think anytime that we're trying to create a different type of movement and we can't necessarily feel it, like I also work a lot with the feet and the toes, and oftentimes I'm trying to get people to control their big toe. And that can be so difficult to try to lift just that toe without the rest of your toes. And so sometimes what I'll have them do is try to touch that toe as they're trying to lift up, so that it's like it's the outside pressure, that outside sensation that connects the brain to that body part. So having something like that where you can straddle that and actually feel that pressure there and start to gain some awareness of that area is really, really helpful.
Right.
That's an awesome
And
tip.
similar to the feet, we may be working in isolation to tease out the pieces that maybe aren't functioning as well as the other parts of that system. But at the end of the day, we really want to integrate that system back together so that it works as a team.
Right, right. Oh yeah, there's so many other places we could totally go with that. That's so cool. So, are there some myths or just some things that are considered, kind of like I mentioned, are there some other things that are considered normal that you see a lot that you wish that people knew weren't exactly normal and they could totally do something about?
Really, pain in pregnancy, most of that can be relieved. The one area that is a little harder is rib cage pain. That is quite normal, right, or quite common. And depending on baby's position, if they're kind of really kind of wedged in up underneath your rib cage, there's not a ton you or I can really do until they choose to drop, right? But if they aren't low in the pelvis because, let's say, the hip flexors are really tight and are preventing them from getting into that position, like that's an area that then we can work on, right?
Absolutely.
The other one that I've had some patients, then like they've been told by their OB that like pain through their rib cage in the front, they're like, oh, you just have to deal with that, right? Or so-called round ligament pain. We can actually adjust the ribs in the front of your body, not just in the back. And a lot of times that round ligament pain that people think that they're having is actually hip flexor spasms.
Oh, how about that?
Sometimes it's a round ligament, but oftentimes it's more of a hip flexor. And that's definitely musculoskeletal in nature, and there's lots that we can do for that.
Yeah, absolutely. Okay, I have another question too, right before we kind of start to wrap this up. But I think there may be some patients who are a little bit nervous about chiropractic care, and maybe they've never seen a chiropractor before. Maybe they've heard that chiropractic care is something that they should be really afraid of. And then, of course, when you're also pregnant, there's a whole other piece, right? We want to protect our kiddos. So can you talk a little bit
Absolutely.
about how we change some of our adjustments for pregnant women as they go, and what some of the options are as far as safety and all of that?
Yeah, and so similar to most chiropractic care, there is a lot of different ways to get the same result or a very similar result, right? Part of why our training is so extensive in our adjustments is to be able to have an option that fits almost every body out there, right? So in pregnancy, one of the biggest things is you just need less force. So when you go to the chiropractor, you shouldn't be getting the same amount that like a very large man would receive in order to adjust their body, right? It's often very gentle, because your hormones are changing in pregnancy, and so your body just literally needs less force in order to allow for those joints to move, which is why the stability part is so key, is because we want to have those structures in alignment, but then we also want to have the muscular stability to be able to maintain that alignment, right?
Yes.
So some of the things that we can do, I personally use a drop table that's set super light, and I, just do a little bit at a time, because the joints of the pelvis have so many moving parts. They're all interconnected, and they're kind of big joints. A lot of people may choose to use like big adjustment to make sure that they are getting everything that they need, but most of my colleagues, we prefer to do smaller adjustments to be able to get it a little bit at a time so that we can get everything moving enough, but not too much.
Right, exactly. One of the things that you mentioned is the hormonal changes that happen when we are pregnant. And what happens, it's a hormone mostly called relaxin that essentially creates this environment where the ligaments and the tendons start to stretch, because that's what you have to do, right? The hip bones have to move and they have to widen so that you can carry this child and be able to birth them as well. But what happens is that it's relaxin isn't just located at the hips. It ends up everywhere because it's floating through your bloodstream. And so we want to be very gentle and make sure we're not getting a ton of very forceful adjustments through the entire spine, because that's when I think we see more injuries. I think we also see just a lot of stimulation through the nervous system and through the spine. Like, we've got to remember that we are adjusting bones where there's tons of nerves, right? And we are making changes and affecting the nervous system. And so I think that it's very, very important to remember that if you do go see a chiropractor, it's great if they do tend to focus a little bit and are, doing a lot of pregnancy. They're very familiar with treating women who are pregnant and what is happening within the whole body, because it does actually have a pretty big impact.
Correct. And I really think that seeing a chiropractor in pregnancy that specializes in pregnancy,
Mhm.
just kind of helps you figure out where to start if you have never experienced chiropractic before. If you have a chiropractor that
Absolutely.
you love and they're willing to treat you in pregnancy, awesome, right?
Yep.
It's not that if you haven't done all of this special training that you can't adjust a pregnant patient, but if you are new to chiropractic and you're trying this in pregnancy for the first time ever, I think you will, like, those patients will feel that much more comfortable in a setting where that person really specializes in pregnancy and postpartum and has the additional training, as well as education and knowledge about everything else that is going on in your body at that point in time.
For
The
sure.
other thing is that often they have different tools and ways to make you comfortable as your body is growing and changing. So for example, I have a table where the abdominal section actually kind of drops out and allows me to make pretty micro changes to the amount of support we're creating for the abdomen, so that it can adjust and change as needed, as mom's body is growing and changing every week, right?
Right. Absolutely. Uh, I had one more question on that too. So and I think one thing that is sometimes missed is that chiropractors do get a lot of this training in school. We do have classes where we learn about pregnancy, right? We have our OBGYN classes. We have just as much actually in biochemistry and physiology, and we actually do get quite a bit more neurology than medical doctors do in some cases. And we get a lot of training in how, not only how to adjust, and not a lot, but we do get, I think, several classes in how to work with pregnancy. So it's not that we're none of us know, like, unless you go to extra training, how to work with pregnant patients. But I think that it's a misconception that chiropractors are not very well educated, I think, in how the body functions and all those different pieces. So I definitely like to try to just, bring that into the conversation for sure. Do you see a lot of patients who are nervous about chiropractic care?
Honestly, I think living here in Oregon,
A little different.
and it is a little different. I think people are pretty open to it and have had some exposure to it. I do sometimes get, people who have never experienced chiropractic until now, because they're like, oh, I knew about it. It was something I wanted to try, but it wasn't a high priority. And then all of a sudden, if they're in a lot of pain in pregnancy and they don't have a lot of other options, right? They don't want to take over-the-counter medication, or they're trying to make other changes in their life, that now is when they kind of start to bring this into their health and wellness.
Absolutely. So we got a couple of tips through this phone call about things that we can do at home. So breathing exercises are something that I think not just pregnant women can do for sure. That's definitely all of us can be working on learning how to breathe and breathing better and creating that more of a cylinder so that your core is all working as a whole. We also learned about being able to breathe into the pelvic floor so we can create a little bit more of that flexibility in our pelvic floor. Are there any other tips you have for people who are kind of stuck at home right now? Like, are there some stabilization exercises or some strengthening exercises that you usually recommend?
So squats can be really great because many women will choose to actually labor and potentially even give birth in that position. But if you don't have the strength to be able to maintain that for a longer period of time, that's not going to feel as comfortable, right? That being said, I do think it's important to have a movement specialist look at your form and really kind of target some of those exercises to you, because it is so much less about the reps and the name of the exercise. It's really, are you doing that exercise, and are you doing it properly and using the right muscles that you are attempting to use, right? So having somebody be able to target a program to you, so that then you can kind of tackle that at home. Now, one of the things that you don't need necessarily a professional for, but I really think that in this time where we're kind of stuck at home and we may not have a lot of other like tangible resources, we can really start to look at some of the other educational resources out there, particularly prepping for postpartum, and really thinking about, okay, what are we going to do as far as meals? Are we going to think about, a meal train? Are we going to prep and store things in the freezer so that it's one less thing that you have to worry about postpartum, right? What are my resources for new parents in the area? A lot of times moms don't look into that until after, but sometimes it can be really hard to make that additional effort to go looking for those resources when you are sleep deprived and tired and potentially dealing with a lot of postpartum hormonal changes and potential changes in mental health. So knowing what your resources are for perinatal mental health is so key, because even just knowing what resources are out there can completely change the experience if you are experiencing postpartum anxiety, depression, or psychosis.
Absolutely. Having a plan is huge. And if you can, because if you have a plan and maybe that one thing that you prepared doesn't work, then you'll have an idea of where to find a plan B, right?
Yeah.
You'll have an idea of where to look for sure. So
For sure.
having somebody that's able to be that resource for you and that guide that's seen you through pregnancy and can then help you postpartum is a really, really helpful resource. So yeah, so having that person that we can get in contact with it, that in case something just isn't quite right, or if we are in pain, or if there's something that we need that we're just not sure where to find that, yeah, they can help us create that plan as we go, but also in case something just doesn't quite go right, you'll have somebody that you can ask and that does this pretty often. I think that's always really helpful to have somebody like that in our corner.
Absolutely. And really kind of having those options ranging from medical advice to, educators in the community support, and then, personal, friends and families that have been there before, right? Because everybody has so much advice and value and experience. And while that might not be your experience, it can be super helpful to just kind of know the variety of experiences out there so that you know that you aren't alone.
Absolutely.
These people may not have your exact experience, but there is somebody out there who can totally understand and relate.
Yeah, absolutely. Well, thank you, Dr. Kaitlyn. This was amazing. I hope that the watchers, listeners found something helpful from this. I know I did. I walked away with a ton. I actually have even more questions now than when we started, so I may have to have you back because I really want to explore some of the other things that we talked about. But I wanted to say thank you again for popping on here and for sharing all of this information with us. If any of you guys have questions, just get in touch with me. Either leave a comment below on this video or on any one of the social media streams. You can follow me at Dr. Kirsten at Instagram and Facebook, and we on Instagram and Facebook, and we can get any of your questions answered and sent over to Dr. Kaitlyn. She also works in Eugene, Oregon, so you may be able to find her there as well. But I wanted to say thanks again, and we'll have to have you on again soon for sure.
Absolutely. Thank you so much for having me on, and I really appreciated all of your insight and would love to join and kind of rehash and kind of touch base on more of the nutrition side of things as well.
Yeah, absolutely. That would be super fun. Okay, thank you.